Imagine controlling a robotic hand with a camera, or with your brain. Let's dive into how that's possible with OYMotion.
A bit of backstory about us. Well, we started in prosthetics, right? And then we noticed that there's also obviously an industry in robotics. Right now, the hands it's being controlled through like the vision right here. Right?
Oh, so that hand's being controlled too?
So it's just a demo, right? Like
Okay.
but the robotics hand can be controlled through everything. It only recognizes like one hand at a time.
Is it picking up my other hand?
It might be picking up your other hand right now.
Hide that.
There we go.
That's wild.
But obviously, the robotic hand can be controlled through anything, right? Like
Uh-huh.
the keyboard. So we originally started with EMG. So those are like armbands, and that's how we went into prosthetics. Right? It's like a control system for amputees,
Okay.
right?
Okay.
But the robotic hands are obviously when it comes to like manufacturing,
Mhm.
they will need more delicate things like that, right? So they might want like a more intricate hand, or let's say like a rescue robot.
So, like a hazardous area.
Yeah, exactly, something like that, right? These hands are rated to like carry over 30 kilograms
Okay.
each, and then so they're pretty strong.
And the hand controls video, but will the head be able to control?
You
hand?
can control the hand using any control source you want. You can use
Can
it. It is a bit hard
Okay.
because another one big reason why we don't use for amputees to control using the head is because over here the data is a lot more encoded compared to like let's say like towards this like
Yeah.
intention is a lot easier to detect
Yeah.
here, right, and understand.
Okay.
So, over here right now we're still like a higher surface level, like high level abstract things, like more like feelings, things like that. From there, we decided that we might as well get the whole suite of bio data, right? So
Uh-huh.
we did obviously the heart rate, so ECG, and then we also did EEG, which is the brain stuff over there that you can see.
It's good to see that.
What these are meant to do is it's capturing obviously your brain data, right? Your electrical EEG data, and then what it does is like it tells you a lot of information about the brain, right? So for instance, for this series, it's meant to be a medical tool, and then you can use it in let's say a clinic or let's say in the ICU, like a patient comes in and they have like brain trauma or something like that. The
Uh-huh.
doctor might need a quick like brain imaging, and this can be used for that case, right? We have more consumers, so it's just lower channel count. We go down
Okay.
a little bit, and that can be used for like mental health, mental wellness. They do something called neurofeedback training, which kind of just like you have like a feedback loop. Basically, you see how your brain progresses. Like you can detect things like sadness, like things like that, right?
Okay.
You can, like basically help yourself train yourself up.
Okay.
Yeah.
Does it like need to calibrate to your head, or how does
Yeah,
it?
so everyone's brain is different, right?
Mhm.
Like you and I, we're different brain. But the thing is, at the end of the day, right? Like, what happens is you get the data and then you transform it into like basically this frequency, and then you look at that, and that's pretty similar, people, person to person, right?
Okay.
Yeah. So there is a normative data set on the brain, but obviously our brain's changing all the time. So one thing we're trying to do is make EEG equipment more accessible, right? So that way we can build a bigger like public data set that changes, as people change, right? Because like things like COVID really affected how everyone's brain works. So
Yeah.
like if you get everyone's data right now compared to pre-COVID, it would be different, right? So,
Okay.
and then over there, that series right there is meant to be more of a research based. It's going to be less expensive, right? This is medical equipment.
Oh.
It's meant for like, let's say a pharmaceutical company is doing like a drug trial, right? Let's
Uh-huh.
say it's for Alzheimer's or some like neuro disease, right? So you want to see how the drug's affecting the brain over, let's say, a year worth of time. And this is something they can put on different patients and track their progress.
Well, thank you, man.
Of course,
Appreciate it.
yeah. Thank you.
Hey.